So in this video we're going to have a look at treating the chest, yet another underutilised area that really doesn't get much treatment. A lot of people are very uncomfortable treating this area. But if somebody's got back or shoulder problems, it's actually quite a key area to look at.
It certainly is. So what we're looking at in this first angle is treating from the top of the couch. Now, I find this a really nice way to start warming up and introducing touch to the area, namely because you can do both sides at the same time, as you can see here. And that gives you an opportunity to compare left and right, and also just to sort of, like, you can have a smile with your client and interact with them quite easily.
The other thing we've got here is the double towel system, which we've talked about before. So we've got one towel, which is your client's towel, and then you can pop a second towel over the top, just if your client's been a bit too brazen. You can be a bit more
subtle.
Thank you.
So what you can see from this angle is we've done some effleurage to warm it up. One-handed is going to be much easier. You're going to struggle with two hands necessarily in this area. But we can do sort of a one-handed cams here, which is what we're sort of looking at. Done a little bit of Pectorals, a little bit more across the diagonal for that. And that can lead straight into a pressure. Again, it's about using your posture to secure the area. And you can see on the other hand, they're just supporting the shoulder joint itself so that we're not actually therefore getting too much movement. And it makes sure that my other hand can stay in the right place.
The other thing to bear in mind is a lot of people don't have a massive amount of muscle across their chest. So yes, there is muscles there, but they're not generally bodybuilders. They're not generally huge muscles.
Absolutely.
So again, you need to go a little bit steady.
So the alternative position is to treat from the side of the couch. Now, this is a really good way if you want to just be looking at one side. I quite like it after I've sort of again done that initial warm up, because it means you can get a little bit more direct and up along under the base of the collarbone, as you can see I'm doing there with some fingers, which is fairly foul, but can be really, really effective. So reinforced fingers using the collarbone as a line to follow can be really nice. Again, followed by some nice broad strokes in and across the head of the glenohumeral joint. It's a really nice way to work.
You have to remember that the pectorals come out over onto the arm and the shoulder area, so it is really important to make sure that you cover the whole muscle.
What you've got here, you can see that I've just moved the arm out. Now that will just change the angle of the pecs. It will expose them a little bit. Now I'm just supporting that other hand with my wrist, and that gives me a little bit more option to use sort of a vibration in that area and just change the angle of the joint a little bit.
You can't create massive movements here, and you are a little bit limited with how you can use your techniques, but you've just got to sort of improvise as you go on along a little bit with this one. You haven't got the massive big broad strokes, but again you won't have the pressure behind it either because you don't have the muscle mass.
So again, working sort of out and along the whole line of the muscle. Little bits of vibrations in this area I find really, really useful, especially to get things moving a little bit more.